Hey everyone, welcome back to my channel. I'm Dr. Sheth, and today we're going to be talking about pap smears. So if you're curious to learn more about why we do them, what it entails, and some of the fears that kind of lurk around getting a pap smear, then this video is for you. If you like what you're seeing, please subscribe to my channel and hit the like button so I know to do more of these. Without further ado, let's get started. All right, so I know I'm saying pap smear with a smile, but most of us are terrified of getting a pap smear. It's hard enough to get to the dentist twice a year for a teeth cleaning. We know how that goes, but to get a pap, oh my gosh, that's like on a whole nother level. I mean, you're in a vulnerable position. You don't know if it's going to be painful or uncomfortable. You know a pap smear is important, but you really don't know why. And so you just put it off. So I'm going to break it down for you guys so that there's no mystery behind getting a pap smear. So let's start off by talking about the cervix, because I don't think most people know where the cervix is and what that's all about. So your cervix is a small organ and it's about the size of a quarter. It's about yay big. And it looks like a donut. And you will find the cervix at the end of your vaginal canal. So if you imagine your vagina to be a tunnel, if you keep going to the end of the vagina, you will hit your cervix. And the cervix is actually the beginning of your uterus. So it's sort of the point where the outside of your body meets the inside of your body. And it has its own different types of cells that go through routine changes. So now that we have our anatomy straight, let's talk about why we do pap smears. A pap is a examination of your cervical cells under a microscope to see whether they're abnormal or not. And what we're looking for when we do a pap smear is to see if there's any signs of changes in the cell that would suggest precancer. So pap smears are used to prevent cervical cancer. And what research has shown is that by getting a pap smear on a routine basis, we've actually decreased the number of cervical cancer cases and the deaths related to cervical cancer, because we're able to use the pap smear as a tool to detect abnormal cells way before it turns into cancer. So what causes cervical cancer? The most common cause of cervical cancer is by a virus called HPV, which stands for human papillomavirus. Now, human papillomavirus, or HPV, comes in many different strains. You have strains that fall in the low risk group, and then you have strains that fall in the high risk groups. And the ones that are in the low risk group do not cause cervical cancer. And the ones that are in the high risk group are associated with causing cervical cancer. Now, you might have heard of HPV before because it causes warts. And if you've been infected with HPV and had a wart on your hand or your foot, you probably had a strain that was in the low risk family. The only way to get the high risk HPV strains that cause cervical cancer is through sexual contact. I just want to put this out there to remove the stigma about HPV. HPV is a very common virus. About 80% of Americans will have some form of HPV at some point in their life by the age of 50. So really there's nothing about hygiene or being clean that will prevent you from getting HPV. It sometimes just feels like the luck of the draw. And that's why we do screening for everybody. Every woman should be getting screened. Because you don't really know what you've been exposed to until you're being tested for it. So in terms of what to expect for the exam, when your doctor tells you that you're due for a pap smear, what they mean is that they want you to come in for a visit, or do it right then and there if you're comfortable, for a pelvic examination. And when they say that they want to do a pelvic examination, what that means is that they want to look at your private area, which includes your external genitalia, as well as your vagina and your cervix, and to also feel inside the vagina for any masses, and do a bimanual, which is pressing on your abdomen to feel your uterus and your ovaries. And when they do that exam, they will use a speculum, which is like a duckbill. Okay, I'm going to use my fingers to show you. And most speculums are about the size of 2 finger widths. And they insert that into the vagina. So if this is the vagina, they insert the speculum into the vagina and they open the speculum. And like I mentioned earlier, the cervix is going to be located at the end. So when they can see the cervix, they'll use a wand to grab some cells from the cervix. Now the wand is pretty simple and basic. It looks like a mascara wand, or it can come in another shape, but the whole purpose is to kind of scrape the cervix to remove some cells that can be sent off for testing. So in terms of pain and discomfort with the procedure, to be honest, I'm not really in a position to tell you whether the procedure is pain-free or very painful, because pain is a subjective feel, and that is something that's very personal to you. So I just encourage you to work with your doctor to let them know about what you're nervous about, what questions you have before the exam. That way you feel comfortable with doing a pap smear. So what if your pap is positive? So that is, a conversation that you really should be having with your doctor. But I want to emphasize that if you get a positive result, it does not mean that you have cervical cancer. It means that you have abnormal cells that need to be monitored more closely. And that's the whole point of a pap, is to detect those abnormalities before they become cancer. So if you get a positive result, just make sure you really take the time to understand those results and talk to your doctor. I've had patients who were too afraid to talk to their doctor when they got a positive result. They were too scared to know what that meant, and that caused a lot of anxiety and avoidance of the healthcare system. So if you are concerned and confused, that is completely normal, and I encourage you to talk to your doctor about that. Another point I want to make is that HPV doesn't always cause cancer. So if you're infected, doesn't mean that you're going to get cancer, right? Most women will clear the infection on their own. About 80 to 90% of women will clear it within 2 years, and about 80% will clear it within 8 months. So if you have been infected and have an abnormal pap that shows that you might have HPV, know that your body should be able to take care of it. And if it doesn't, that's why we're doing these pap smears, to continue monitoring it. So while I'm here, I should probably mention how to prevent spreading of HPV. So I have 2 pieces of advice. The first is straightforward: use condoms. HPV is passed skin to skin, so by using condoms, you're preventing that contact and reducing the risk for transmission. The second is to get the vaccine. If you fall within the age group of getting the vaccination, I highly recommend it. It will cover most strains of HPV that cause cervical cancer, and it also covers most strains that cause genital warts. It doesn't cover all the different types of strains, so it's still important to get screened, but it does cover most. So if you are a candidate for that, I highly recommend you talk to your doctor about getting it. So here's my take-home message. If you haven't gotten a pap smear and it's been due and you've been getting reminders for it, please schedule one. I hope that this video helps to kind of debunk some of the fears and myths behind getting a pap smear. And really, this is a part of your routine healthcare, and science has come such a long way that we're able to actually prevent cervical cancer. So if that is available to you, I would encourage you to take advantage of it and engage with your primary care doctor to get screened. So that's a wrap. I hope you guys enjoyed this video, learned something new, and hopefully you guys will want to see more content like this. Please comment below about any ideas you might have, and I will see you guys next time. Bye.